Good health is our most precious asset, and it can make or break a career. Seafaring is a tough and demanding profession, and keeping fit and healthy is essential for you and your shipmates. In this series, we look at the many aspects of keeping healthy, from personal care, fitness, diet, disease prevention, even occupational hazards. But in the end, it's down to you, the seafarer, to follow practical advice and guidance and stay healthy throughout your life at sea and at home. In this first programme of the series, we look at the importance of personal hygiene and its role in combating infections. More details on the subjects covered can be found in the accompanying workbook. The confined environment of a ship with warm conditions, air conditioning and shared facilities is a congenial environment for infection to spread. But although we live our lives surrounded by billions of germs, it's in our power to keep them in check. And where better to start than with you? Personal hygiene is not all about smelling fresh. It's about protecting yourself and your workmates from commonly caught infections. Everyone knows how quickly colds, flu, stomach disorders, and even more serious illnesses can be passed around. We all carry germs in our noses and throats, and these end up in the air we breathe and the surfaces we touch. However, you can help to control infection, especially coughs and colds, by following two basic rules. 1. Wash hands thoroughly with soap and water. 2. Cover the mouth and nose when coughing and sneezing. Hands come into contact with dirty objects every moment of the day, so always wash hands thoroughly for at least 2 minutes in soap and water after working and using the toilet, and always before eating. It's best to remove your watch before starting. Apply enough soap or hand wash to cover all hand surfaces. Rub each palm over the back of the other hand. Rub between the fingers of each hand. Rub your hands with the fingers together. Rub around each thumb and in circles in your palm. If available, use a nail brush as well. Rinse off with clean water and dry thoroughly. Clean hands are a good defense against many infections. With sneezing and coughing, both these actions release thousands of minute droplets into the air around us, to be breathed in by anyone close by. To contain the spread of infection, simply cover the mouth and face when sneezing or coughing. As an absolute minimum, you should use your hands, while some people might choose to wear a mask covering the mouth and nose to reduce the risk of contracting or spreading the virus in the air. It's also very important to wash hands if you've covered your face when sneezing and coughing. Touching a door handle, handrail or another person with unwashed hands will very likely deposit the virus for someone else to pick up. Always safely dispose of used tissues, and you should never spit anywhere on board ship. Dental health is a very important part of personal care. Toothache causes intense pain and may adversely affect your performance, your concentration, and generally present a risk to safety. Tooth decay and gum disease are largely preventable through brushing for 2 minutes, twice a day, morning and evening, and avoiding sugary drinks and snacks. Avoiding sugar is a good rule to follow anyway, as this is a major cause of weight gain and diabetes. As well as brushing, using floss or other methods to clean between the teeth is also important, as dental plaque can build up where the brush may not reach, causing gums to become affected by bacterial action, leading to a range of complications such as gingivitis and tooth loss. Typical symptoms of tooth decay and gum disease are sensitivity to hot and cold food and drink, toothache, bleeding gums, and very often bad breath. Remember that when at sea, you're a long way from the dentist. To help prevent these problems, we should all ensure that we have regular dental examinations and treatment when ashore. A tooth abscess in mid-ocean would be agonizing. Your personal living space is also important. You'll be expected to keep your cabin clean, that any sanitary towels, used tissues, especially if you have a cold, need to be disposed of, that any food remains, packaging and general rubbish is securely binned up and disposed of. Clothing, especially overalls, must be regularly washed to remove any harmful residues such as dirty water, paint, oil and chemical products. Make sure that towels, clothes and underwear are clean and that wet items are not left lying around for bacteria to grow. Handrails and door handles are touched all the time and need to be regularly cleaned with a disinfected cloth. An important part of the working day is mealtime, when many of the crew meet up. Good ship operators take food hygiene very seriously, with cooks and galley staff receiving very rigorous training. And it is the responsibility of all crew to help maintain these standards. As you've seen, hand washing is vital. Never sit down to eat with dirty hands. If you do, every time you handle anything or pass items to anyone, you could be handing out all manner of germs. It is normally the rule on board ship that no one can enter the mess in working clothes. This is an important hygiene precaution, so respect the rule. And finally, it's far better that any likely infection is left ashore. Anyone suffering diarrhea, influenza, or any easily transferable illness should remain at home and receive the medical treatment required. It's more important to avoid bringing illness on board, so sick crew should not be encouraged to travel. This will only put themselves and their crewmates in a position where the medical help they may need might not be readily available. You now know what you can do to reduce the risk of spreading infection to other crew members. But what happens if there is illness? Ideally, everyone should, on joining or while on board, report any symptoms or existing illness so that they can identify suitable treatment, which may include possible isolation. Starting with the common cold. Colds may not seem serious, but they do lower people's performance and cause them to tire more easily, which can be dangerous. The symptoms of colds are familiar: headaches, sore throats, slight temperature, runny nose, and sometimes a cough. Colds pass quite quickly, and the best treatment is to take plenty of fluids, paracetamol-type medication, which are readily available in the medical chest to ease aches and pains, and, if necessary, cough medicine. But bear in mind that cold medication can have a sedating effect. Influenza or flu is far more serious, highly debilitating, with symptoms similar to the cold, but more extreme, with high fever, muscle pain, possible vomiting and diarrhea. Flu requires bed rest, plenty of fluids and medication to reduce aches and pains, and can, at worst, lead to further lung complications such as pneumonia and bronchitis. Bronchitis is an infection of the lungs. The main symptom being a severe cough. It is likely that your cough will bring up thick yellow-grey mucus, phlegm, although this does not always happen. If you have bronchitis, your cough may last for several weeks after other symptoms have gone, and some people may experience shortness of breath or wheezing due to inflamed airways. In the confined environment of a ship, gastrointestinal infections can spread rapidly between crew and passengers. A common cause of stomach upsets is norovirus, usually brought on board by someone already carrying the virus, and is spread by vomit, feces, and hands. The virus is highly contagious. It can affect people of all ages and causes vomiting and diarrhea. Hygiene is the best way to prevent or contain any outbreak, and everyone on board can help by following obvious guidelines, such as always washing hands after using the toilet and before and after eating. There's no specific cure for norovirus, so you have to let it run its course. It's usually mild and shouldn't last more than a couple of days. Treatment will be to keep away from fellow workers, drink fluids, and maintain personal hygiene. As this programme has stressed, always wash hands thoroughly before or after any possible contact with infection. Anyone contracting the virus must not ignore symptoms and battle on. They'll be spreading the germs everywhere. In the workplace, despite personal protection equipment, PPE, cuts and grazes will occur and can become seriously infected if not treated immediately. Any such injury, however minor, must be reported to the responsible ship's officer to ensure that immediate first aid treatment prevents any possible infection of the wound. Wash and clean the wound, protect with band-aid or dressings, and always follow the ship's medical guide.
Thank you, second. Thanks a lot. I will be careful.
Also, many infections are present in body fluids and blood, so special care must be taken where blood is present. On board ship, there are precautions that should be adopted as normal practice to avoid any risk of infection. When dealing with an accident, however minor, if there is blood present, ensure careful handling and disposal of needles or other sharp objects. Hand washing before and after a procedure. Use surgical gloves and masks when in direct contact with blood and other body fluids. Safe disposal of waste contaminated with body fluids and blood. Proper disinfection of instruments and other contaminated equipment. In this programme, we've looked at the importance of personal hygiene, starting with washing your hands thoroughly and frequently, at taking good care of your teeth and gums, the importance of keeping your environment, cabin, clothing, towels, clean, reporting illness and even minor injuries to the officer responsible for medical care, treating cuts and grazes immediately, and taking special precautions when dealing with an accident where blood is present. Prevention is always better than cure. Everyone on board ship must be aware of early symptoms and to report this to the appropriate officer. Better to be aware of a potential illness early on than spread it throughout the crew.